case. Next slide. The governor talked briefly about testing. It's currently available, and we are using it at the Department of Health for people who are symptomatic and at risk. In other words, they are ill and they have risk criteria. This is a brief history about how the tests have developed. Initially not as much availability. CDC developed it. Most of the testing was done through the Bureau of Public Health Labs. And now we've had expansion with regard to private commercial laboratory testing. The healthcare providers in our community were provided an algorithm yesterday with updated guidance based upon CDC and the Florida Department of Health of who gets tested, who's recommended for testing, and the laboratory options that they have. Next slide. So risks are changing over time, but the Department of Health continues to put out guidance. Again, currently in Nassau County, there may be some concern about public risk associated with a single case. So it's important for us to understand what a health department does to reduce public risk. The county health department isolates the patient who is positive. We determine the travel and exposure history and who the case had close contact with when they were ill. This is called contact tracing. Then the people who have been exposed are notified by the county health department and given instructions on self-quarantine and isolation observation for symptoms. With a single Nassau County case, we have already reached the identified contacts in our community and provided instruction on quarantine and isolation and monitoring. There are some general instructions for the public. Again, if those based upon your risk criteria, you should consult with the health department and your provider and self-isolate. Please call your healthcare provider ahead of time to tell them of your risk factors. And remember, you can only get COVID-19 from someone with the disease and who's ill. But avoid contact with others. Do not travel while you're sick. Cover your mouth, nose, and cough, sneezing, and often wash your hands, wash your hands, wash your hands. Prevention is our next important strategy. Again, I'm not going to spend a lot of time with this. I think many of you already are familiar with this and hopefully not only are aware of the message, but sharing the message with others. Next slide. Washing hands with soap and water, using hand sanitizer with at least 60% alcohol, avoiding touching your face, eyes, nose, mouth, and avoid close contact with sick people, and then most importantly, stay home when you're sick. Travel advisories, again, I will go quickly through this because this is rapidly changing, and what I tell you right now will probably change. So I would encourage you to look at the CDC and Florida Department of Health websites for the most recent and accurate travel advisories. Let's go ahead and go to the next slide that deals with past travel advisories. We'll go to, again, keep going. Public health monitoring, I've kind of reviewed this already. The health department does get information on travelers from Iran and China, and there's been definite guidance that's been sent out with regard to other now impacted areas in our world, and also.
You've been listening to an update from Nassau County, where a 68-year-old man has been confirmed to have the coronavirus. It's a travel-related case. Let's move on now to some information that we've gathered from our reporters today across Jacksonville and the First Coast to keep your family safe. First Coast News at 5 begins now.
Always on your side. This is First Coast News at 5.
Across 12 counties in Florida, now 3 confirmed cases on our First Coast. We're on your side with facts, not fear.
And new revelations from NAS Jax tonight. What we're hearing from a contractor on base about Breonna Williams and what she said and didn't say about the disappearance of her daughter.
And tomorrow's the first round of the Players' Championship. Our live reports just moments away, including a look tonight at how one of the world's best golfers is giving back.
But first tonight, we are on your side, bringing you the facts, not fear, as we continue to track the coronavirus. I'm Anthony Austin.
And I'm Heather Crawford. So the COVID-19 coronavirus is now here on our First Coast. We know there's 1 confirmed case in Alachua and 1 case in Nassau County, also a confirmed case in Camden County tonight.
In Washington, President Trump has announced a primetime address to the nation on both the coronavirus and larger economic concerns. That's set for sometime around 9 o'clock tonight. Now, at this hour, the World Health Organization has declared a pandemic Now, we know that word may sound scary to you, but all it means is that the coronavirus has spread over a large area, for example, worldwide. And we already knew that, but this declaration is a new step.
So let's tell you what's going on closer to home. The Duval County School District has not issued any plan to keep students off campus after spring break. Classes here are set to resume next week. We've also spoken with Baptist and Wolfson Children's Hospital. They are now working on some new restrictions to help keep everyone safe. And we're going to take a closer look at those changes ahead on First Coast News at 6. Within just the past hour, we have heard from Florida Governor Ron DeSantis. He updated us with the full picture. So there are 28 positive cases of COVID-19 in Florida right now. 8 of these are brand new cases from yesterday. 2 people in Florida have died from the coronavirus. And of the 28 cases, 12, they're in 12 different counties. Currently, there are 147 pending tests in Florida health centers. So far, about 300 tests have come back negative. 877 people have been monitored for 14 days, and there are 353 people currently being monitored.
Now, earlier this week, Governor DeSantis declared a state of emergency in Florida, which will help allocate funds to help fight the virus. Today, the governor announced a halt of visitations to assisted living facilities.
Today, we're announcing a further effort. I've directed Director Moskowitz as the state coordinating officer to temporarily prohibit visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes.
Today in Congress, the head of the National Institute of Allergy and Infectious Disease told lawmakers that the mortality rate for COVID-19 is 10 times that of the flu. And he says he expects things to get worse before they get better.
We do not know what this virus is going to do. We would hope that as we get to warmer weather, it would go down. But we can't proceed under that assumption. We've got to assume that it's going to get worse and worse and worse. How much worse we'll get will depend on our ability to do 2 things: to contain the influx in people who are infected coming from the outside, and the ability to contain and mitigate within our own country. Bottom line, it's going to get worse.
Late this afternoon, Florida Senator Rick Scott released a list of 9 recommendations he wants the U.S. to take to limit the spread of the coronavirus. Now, that includes temporarily shutting down all U.S. borders to foreign tourism and requiring Americans abroad to be screened and isolated for 14 days when they return home.
He also wants to close all schools for 2 weeks where the virus is spreading, close government buildings to visitors, and he calls on hospitals to halt all elective procedures. As of tonight, these are only recommendations from Senator Scott. They're not actually in place.
And our On Your Side team is spread out all across our area to bring you up to date, covering every angle from Nassau County to Camden County. Jocelyn Howard tonight is standing by in Georgia, but we want to begin now with Troy Kless on your side. Troy?
Thanks, Heather. Well, here at the Florida Department of Health in Yulee, there is actually a notice on the door that is warning people about the symptoms of COVID-19 and what to do if you think you may have some of those symptoms. Now, again, with this one confirmed case here in Nassau County, we're not sure specifically which area this man may have been in, but we do know that now some people's level of concern has been raised.
Cheryl Hicks from Amelia Island taking some precautions seriously after learning one case of coronavirus was reported in Nassau County.
Sorry to hear it. I figured I'd be concerned when it hit home, and it's hit home, I guess. So
she's acting on the reminders to wash her hands and avoid crowds. People already stocked up on things like hand sanitizer and N95 masks. Steve Turner says both of those items are out at the Turner Ace Hardware in Fernandina Beach.
Like 3 weeks ago on the mask, everyone bought them, and we were trying to get more, and they weren't available.
Coronavirus has put local health officials on alert. It also led to Concours d'Elegance taking additional measures this past weekend. They added additional hand sanitizer stations at all entrances, food courts, and other areas. They also urged anyone with flu-like symptoms to stay home. The event attracted tens of thousands of visitors to Fernandina. Nassau County health officials say they are monitoring their only confirmed case of COVID-19 closely. The 68-year-old is isolated and will be until cleared. Meanwhile, Hicks hopes that people do not let fear over COVID-19 control their actions.
I don't know if we made too much of it and panicked over it. I hope they get a handle on this.
We asked for some additional details about this particular case, but the Department of Health says that they cannot release additional information due to patient confidentiality, but they are working to learn more about this man's travel history and if he may have come into contact with anyone while he was sick. We're live in Nassau County. Troy Kless, First Coast News, on your side.
Troy, thank you. In Camden County, Georgia, health officials have confirmed that one person has tested positive for coronavirus and another is awaiting test results.
Both patients are being treated at the Southeast Georgia Health System. On your side's Jocelyn Howard is at the hospital right now. Jocelyn, what do we know about these cases?
Yeah, well, the one case that we know tested positive, the woman was 29 years old and she actually came here on Saturday presenting symptoms, but doctors didn't test her and they actually sent her home.
The Georgia Public Health Lab has a positive result and we're awaiting confirmation from the CDC.
The 29-year-old Charlton County female traveled to the Camden campus's emergency care center with respiratory trouble on Saturday, but was treated and sent back home.
The transmission is respiratory droplets. So people, when they sneeze or cough, it requires close contact with that individual in order to be considered at risk.
The woman returned on Monday with worsening symptoms. Doctors determined to isolate her at the hospital until GDPH would issue her a COVID-19 testing kit.
Fever, cough, shortness of breath are the common symptoms. Feeling tired, achy, headaches, sore throat, runny nose.
Health officials say the woman has no travel history or known exposure to the virus. The Charlton County School District sent this email out to parents today stating the woman does have two close relatives who work in the school system. They will be out of school for an appropriate amount of time.
The overall risk with COVID-19 to the general public remains low. And we certainly encourage the best prevention measures that we would with any respiratory virus.
The GDPH is working to notify caregivers who have treated this patient prior to her isolation, as well as all patients who may have had contact with these caregivers.
Then make recommendations for those individuals to self-isolate and to monitor for symptoms.
Now, you just heard from the Georgia Department of Public Health, and we just actually talked to hospital officials about why this woman was sent home on Saturday without being tested, and we'll bring you those answers coming up at 6. Reporting in Camden County, I'm Jocelyn Howard, First Coast News, on your side.
Jocelyn, thank you. And if you want to see an interactive map of where there are confirmed cases of the coronavirus, just text the word MAP to 904-633-8808. Once again, just text that keyword MAP to the phone number you see on your screen and we will send it to your phone right now.